Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at the NYU School of Medicine. California just took a big step to empower patients and would-be patients to avoid disciplined doctors. They have worked with the medical board in the state to create an app, something you can have on your phone or your iPad, and instantaneously get updates on doctors that you may be seeing. I think they allow up to 16 physicians to be tracked. And you'll get information about disciplinary actions or revocation of license from the app. So while we often say to patients, if you're going to try out a new doctor, check to see their status with the medical board if you're concerned about any license issue that they might have had that led to discipline. In most states, it's very difficult for people to find that website or know what to do or even remember to do it. I applaud what California's doing. You know, medical boards, state to state, are very conservative in revoking licenses and in administering punishments. Some would argue, and I am among them, that they're too lenient, that they don't take a Me Too attitude that says, look, one conviction of sexual assault, that's it, you lose your license. They may, in fact, be in situations where they allow supervised practice or someone must be in the room, but that's a topic for another day. What isn't something I think that ought to be up for debate is the right of the patient or someone who's thinking about starting off with a new doctor to see what their status is. If you're going to be informed, if you're going to make choices about your healthcare provider, I think it's relevant. I think it's important to know whether they have had a license revocation, whether they are practicing with disciplinary administration from the state licensing board. Historically, I think there's been a little bit too much of an insider club to the licensing board activities in every state. They basically have had heavy physician perspective and peer review, but it hasn't been oriented toward patient empowerment. Physician to physician, people make decisions and say, let's put something in place that limits practice on this individual, or maybe we revoke a license. But it doesn't happen often, and these bad guys get to continue to practice, often costing everyone in medicine a huge chunk of change for their malpractice fees, misconduct activities, and so on. Now look, when it comes to disciplinary actions and revocations by state medical boards, I am well aware that many physicians believe that you don't get the full story just by having something listed on a website that says license revoked or under disciplinary censure or had a letter in their file or whatever. I get that, and I think sometimes the complaints are valid. But what should be happening is the patient or the would-be patient can ask the doctor about what their thoughts are concerning what the disciplinary action is that the medical board took. It's a subject for discussion. I understand it might not be an open and shut case in every instance, but nevertheless, if we're going to get patients to trust their doctors, if we're going to have the public supporting the system we've put in place for medical licensure, I think we've got to have some way to trigger a discussion and not have the accusation be that we're not sharing this information, it's kept behind closed doors. I don't think that's the way forward in terms of cementing trust. So at the end of the day, while it isn't in some ways comfortable to think someone's watching me all the time at the medical board and is going to put up information about me if I get into trouble and wind up getting penalized, I still believe that's the right thing to do. The way to cement trust between doctors and their patients, between medicine and the public, is to say, we do what we can to make sure that you know when someone has been punished, that you know when someone has had their license revoked. If you choose to discuss that with your doctor or discuss that with your new doctor, that should be your right. So I hope other states emulate what California has done. I'm Art Kaplan at the Division of Medical Ethics at NYU. Thanks for watching.